So what sort of cases have you come across that involve delays or a misdiagnosis?
When you get a delay that's of a significant amount of time, it can make a difference to either treatment options or the outcome for you.
What's the purpose of the compensation?
Or even if it's just replacing your income so you can pay your mortgage and not be worried that you've got bills mounting up and you may lose the roof from over your head. Yeah.
You know, as soon as you believe that there is something that's gone wrong or that you may have suffered an injury, it's best, if you want to take advice, to take it as early as possible.
If you see the right experts, you get the right reports, you get the compensation you deserve.
Hello, and welcome to today's episode of Medical Negligence Matters. Today we're going to be looking at misdiagnosis and delays in treatment. You know, what does that mean and what can be done about it? And joining me today is my good friend and colleague, Tami Frankel. Hello, Tami.
Hello.
So looking at delays in treatment, I think inevitably in the system that we have at the moment, there are some delays that are inevitable with the burdens that we have on the National Health Service. And I suppose the critical thing from our point of view is identifying those cases where there is delay that is culpable in some way.
Yeah, because in a way, everything from the day you're diagnosed is a delay in terms of you not getting the treatment that would benefit you. But yeah, there are lots of guidelines as to how quickly people should be treated. And I think at the moment we're missing a lot of those. But when you get a delay that's of a significant amount of time, it can make a difference to either treatment options or the outcome for you.
And of course, the question of degree is very important, isn't it? I mean, there are some conditions where a delay of even one day can be very significant.
Meningitis or something, yeah.
Exactly. And yet, in other cases, a delay even of a few months may make absolutely no difference to the outcome. And I think from our point of view, the challenge often is not only identifying whether or not there has been any culpable delay, whether there are symptoms and signs that could have been picked up and weren't, but more importantly, whether that delay has made any difference to the outcome.
Yeah, absolutely.
So what sort of cases have you come across that involve delays or misdiagnosis?
Often they tend to be cancer cases. People receive reassurances, maybe from a GP, they're going along with a particular symptom, that they're reassured is something relatively innocent. And so they're not referred on for tests or to see a specialist. And it leads to a delay in their diagnosis, which in turn leads to a delay in their treatment. I think for cancer cases, we tend to say as a rule of thumb, anything much less than a 6-month delay is unlikely to have made much of a difference, because you're looking at a difference to either, or both, of the treatment options available to them and the outcome for them, the potential prognosis for them, whether they've skipped into another prognostic group.
Exactly. I mean, of course, there are some diseases which sadly have quite a poor prognosis no matter what you do. And unfortunately, in those cases, if there has been a delay, it may not give rise to any significant claim because there's no significant difference to the outcome. And it's obviously important for us to identify those early on, because we don't want people to be put through the process of investigating a claim if really it's going to come to nothing.
Really ill anyway and have to go through the stress of a claim to get nowhere or really not get very far. Yeah, absolutely.
But we also see quite a few cases, don't we, where actually which are really time critical. I mean, things like stroke, a delay of even a quite short time in diagnosing a stroke can be absolutely catastrophic.
Well, those are the sort of things when people go to A&E complaining of something and they're triaged wrongly, so they're just not seen until something, it's a crash call and then it's too late to do the thing that could have saved them. Yes, no, absolutely. And I mean, things like aortic aneurysms that rupture, if you leave those too long, it's usually fatal. So really can make a difference.
Yes. And so in terms of working out what the claims are worth and what you can claim for, I suppose it depends very much on the underlying condition, doesn't it? And untangling what would have happened in any event from what has happened as a result of the delay.
Yeah, you need to look firstly at what should have happened, and then what would have been the outcome for that person. Had that thing happened, had that treatment been provided, how would they have been quite often they wouldn't have been well or completely well. They wouldn't have had a completely normal prognosis. They might have had treatment that would have been debilitating in some way, teasing out from that where they are now and where they would have been. And that difference is how you calculate your compensation.
That's right. It's the difference between where they are and where they would have been. And I suppose in the worst case scenario, I mean, and we have seen some of these cases which actually end in fatalities.
Yeah.
Those cases were particularly where the individual was, for example, the breadwinner.
Yeah.
Those can
relatively
result in
young children. Yeah.
Exactly. Very significant damages claims.
Yeah.
Because the loss of earnings, the loss of financial support that individual gave, quite apart from the...
Yeah, you can get to hundreds of thousands more depending upon their earning capacity, their age, the family they're leaving behind. But of course, sometimes if the prognosis was maybe not so good anyway, and so the difference made to them by the delay in diagnosis isn't so large, the value is a lot lower. So it's very difficult to know on day one until we have a medical expert to tell us where they would have been and where they are now, exactly what sort of size of claim it is.
So, of course, it could range from a few £1,000s to a short delay and no real change in outcome to many hundreds of thousands of pounds if it's resulted either in a loss of a breadwinner or someone who has survived but is unable to return to work.
A stroke, for instance, would be that. Yeah, somebody who could have been saved if they'd been seen and treated in time and now isn't and needs round-the-clock care, the same really as any brain injury. It's exactly the same things. Maybe they need accommodation, carers, case management, all the therapies. Yes, so the same size multi-million-pound claims as any other head injury.
So what's the purpose of the compensation?
It's to put people, insofar as money can, into the position they should have been if the negligence hadn't occurred. So you look at where the person should be if there hadn't been a delay in diagnosis and treatment, and you say, what can we do to put them back there? So if they've lost their mobility, well, let's give them aids, let's adapt their home, let's give them care so that they can access the life that they should have had.
Yes, and I suppose if they're not able to work, it's compensation to replace the earnings that they would have had.
Yeah.
The cost of care.
The cost of care and various therapies. I mean, really, it's in the larger cases, it's often the same sort of award calculated in the same sort of way as it is for the more major brain injury cases. It's
I suppose,
the same.
Yes, it's true, isn't it? Because in a sense, when you get to the point of working out what the compensation is and what it's going to do, it doesn't. How the injury happened becomes less relevant.
But
it's well, this is where we are now.
Yeah.
What do we need now in order to make or to compensate this person for what they've lost?
Exactly, for what they've lost.
And sometimes we have to get quite a lot of expert evidence on that.
You do need a lot of experts. And I think clients often don't appreciate how many people they're going to need to see. I mean, it's often they see 10 or 12 experts for us. And again, they see the same number for the defendants. And it can be really tiring for them. It can be really tiring, but it's worthwhile because if you see the right experts, you get the right reports, you get the compensation you deserve, and you get the facilities and the therapies and the input and the care that you need and you deserve.
The evidence that we need to support a claim can vary depending on the type of the injury, doesn't it, really?
Yeah.
But in many cases, the initial evidence on breach of duty will be from a medical expert practicing in the area, usually, which let the patient down. So if they've gone to A&E with their headache or whatever, it's going to be a consultant in A&E medicine who we're going to look at for breach of duty. But because the outcome can be a different sort of physical injury, for instance, would want maybe a neurologist, you would want all sorts. And depending on why they had a stroke, do you need a hematologist? Do they have a clotting disorder? There are lots of things that come into it, and you'd need all of those because, of course, if they have something that's predisposed them towards whatever's gone wrong, that feeds into how they would have been in the future. It's interesting, isn't it? Because I think the selection of expert evidence in these sorts of cases can be particularly challenging because, of course, sometimes the misdiagnosis or the delay in diagnosis happens because the individual patient is actually under the care of the wrong type of doctor. So, a condition in one area of the body may have been missed because they were under the care of somebody who specialised in something completely different.
Yeah.
And so when you're looking at the type of evidence that we need, it's very important to look at not only the type of doctor who was actually caring for the patient, but the type evidence from the type of person who should have been looking after the patient.
And what they would have done if they'd been, yes, so you'd need the doctor who didn't refer them to somebody to say, yes, they should have been referred. And also you need time limits on that. Should have been, how long was it reasonable for this speciality to keep them, and then to have been referred on, when would they have been seen, and what would that person have done? And that all leads into where should they be right now as compared to where they are right now.
Yes, it's sort of unique to this type of case, isn't it? It's almost entirely hypothetical quite often, because you end up where you are, but you ought to have started from somewhere different. And that's it's working out, well, what the scenario would have been with appropriate treatment. And that can be quite challenging, but interesting.
Very interesting.
But very important that you get the right sort of experts.
And experts who know what they're doing, not just the right speciality, but ones who we've worked with before, ones who know how medical negligence claim runs, ones who know how to help us, because of course sometimes you rely on them to tell you the next step. We have a lot of experience, but we're not doctors, we're not medical experts.
No, quite right. And I think the selection of experts is I mean, it's tricky in all cases, but I think in these cases it's particularly important. But I think it's also important that the experts that you're using are people who are still in clinical practice themselves, isn't it? Because they have to have relevant knowledge of what's happening in the medical world. It's no good getting somebody who's been retired for 20 years, who might be completely out of touch with modern day practice.
Yeah, they have to know what's available, what would have been done at that point in time in that scenario. Yeah, absolutely.
Because doctors have to be judged by current standards and judged by their peers. In reality, it's what would competent, reasonable medical practitioners do in these circumstances? What ought they to do?
Yeah, so I suppose if you have someone whose misdiagnosis actually, or delay in diagnosis, spans back 10 years, you need someone who was in practice 10 years ago, not someone who's more recently in practice, because you need to know 10 years ago what was available to even refer them to, or what investigations were available, and how would you have been looking at that stage? What should they have done? And of course, what might have been reasonable 10 years ago might not be reasonable today.
And of course, time limits are slightly different in these sort of cases, aren't they? I mean, the 3-year time limit that applies to all clinical negligence cases applies equally to misdiagnosis and delayed diagnosis claims. But of course, the calculation of when that time starts to run is different, isn't it?
Yeah, it's different because it has to be date of knowledge. You don't always know that you've had a delay in diagnosis. In fact, it almost says it itself, because if you knew there was a delay, you wouldn't have allowed the delay to continue. So it's only once you find out you have an injury that you then have any knowledge. And so your 3 years will run from then. And of course, if you have something like a stroke, which isn't diagnosed, and you have a catastrophic injury as a result, then you probably lack capacity. So your limitation is not 3 years. You don't have capacity. There is time limit.
But I suppose the same applies, as we say in all of these cases, as soon as you believe that there is something that's gone wrong, or that you may have suffered an injury, it's best, if you want to take advice, to take it as early as possible.
Absolutely.
Because the evidence is fresher, your memory of the events that happened is better.
Yeah.
So it's always better to get
started. And if you're going to get compensation, especially if it's a larger injury, you get it earlier. You start to live that better life. You start to have the money that can help you to get the adaptations, the care, the therapies, whatever it is. Or even if it's just replacing your income so you can pay your mortgage and not be worried that you've got bills mounting up and you may lose the roof from over your head. Yeah.
So what advice would you give to somebody who thinks they might have suffered as a result of a misdiagnosis or a delay in their treatment?
If you think that you might have a medical negligence claim of any sort, call a specialist solicitor, ask them. You're never going to know otherwise. And the sooner you do it, the sooner you'll have an answer to your questions. And if you do have a claim, the sooner you'll have the compensation that helps you to get on with the rest of your life.
So finding a specialist solicitor is a really important first start, isn't it, really?
Absolutely.
And I think both of us really only deal with clinical negligence cases. And I think that does make a difference, because the approach is fundamentally different from many other types of litigation.
It's absolutely different. I mean, even personal injury specialists are not specialists in reading the medical records the way we read the medical records. They're not specialists in obtaining medical reports for the purposes for which we obtain them. So you really do get a different level of service if you go for a clinical negligence specialist.
And how do you go about finding a true specialist?
Probably the Law Society website is a good place to start. You can Google, but you really want a solicitor who has a specialist accreditation, AVMA or the Law Society, and an accreditation in clinical negligence, not simply in personal injury, because it is a really specialist area, which I think is why we've always thought it was important to get and keep our accreditations. I mean, it takes time to get your accreditation. It takes effort.
Yes, but it gives people some reassurance that we really do have the expertise and knowledge that they need in order to get the best possible outcome.
Do it to reassure other people. We already know that we're specialists. We don't need someone to accredit us to tell us that. It's to help other people realise and find us. Yeah, absolutely.
Find their way to the right place. And I think also that specialism is a greater guarantee to the client that they will get the right compensation awarded to them in the end. I mean, I think that there are some firms who perhaps concentrate more on high turnover, trying to get the cases through as quickly as possible, not necessarily getting the best possible outcome.
No.
And it's very important. Each individual client should have their own personal circumstances.
You want the right outcome, not a quick outcome. It's got to be the right outcome for your client. Yeah, absolutely.
Thanks, Tami. We've covered an awful lot of things today in this particular episode, and I'm sure that we'll come back to them again in future episodes. But for now, thank you very much for being here.
Thank you.